numbers are that more than 55% of the patients on a cancer drug get a dose delay. How you can prepare patients after surgery for the period when they go home. All patients have some things in mind what they're most afraid of when it comes to the treatment, and it's very important to address those needs. So when you know, for instance, it can be that you get nausea from chemotherapy or hair loss, or that you don't know how to bring your children to school, or how you do it with work. Hi, I'm Dr. Kasim Boers-Doets. I'm from origin a nurse, and I specialize into side effect management, especially with immune oncology and with target agents. What I have learned in my career is that we can do so much more for patients than we do right now, and especially when it comes to prevention of side effects from cancer medication. Because the numbers are not lying. The numbers are that more than 55% of the patients on a cancer drug get a dose delay. So instead of 4 weeks, 6 weeks in between, because of side effects. And more than 1/3 of the patient get a dose reduction. And nearly 1/5 of the patients will stop early with the treatment because of the side effects. And that's are huge numbers we need to decrease. And that's the reason why I became a side effect expert, because I told my patients I will help you to get rid of the side effects. So my presentation at MASCC is this time how you can prepare patients after surgery for the period when they go home. And it depends on when the surgery is. If the surgery is in the beginning of the treatment, in the middle of the treatment, or at the end of the treatment. The patients have all the time different needs depending on when the surgery is in the treatment journey. And of course, every patient has his own specific questions and needs depending on their personal situation. And that's so important. And if you want to know which questions they have and what their information need is, it's important to ask them 3 questions. And I always say, when you're starting a new treatment, ask the patient, the first question is, what did you know already? What have you heard already? So what are your needs? And what do you expect from me today? Because when they can tell you what they expect from you today, you know where you need to focus on at that moment. And the third question is, where are you most afraid of? Because all patients have some things in mind what they're most afraid of when it comes to the treatment. And it's very important to address those needs. So when you know, for instance, it can be that you get nausea from chemotherapy or hair loss, or that you don't know how to bring your children to school, or how you do it with work. These are all totally different needs, and you need to address the needs of the patient first before you can inform the patient about the further treatment. Because when they have a question in their mind, they keep the question in mind and can't listen. And when you turn it around, when you start with asking questions, what bothers you most, they get space in their head and they get space for the information you're giving, and you will see you will have such better treatment outcomes if you do it instead of you not doing that. So this is where my presentation is about.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.